You lie to patients when you charge them twice as much for an unimproved drug, and then you lie to policymakers when you tell us that R&D justifies those price increases.
Democratic Congresswoman Katie Porter once again did a fantastic job exposing the greed of a CEO. This time, Richard Gonzalez, the CEO of AbbVie, a big pharma company. AbbVie, the makers of Humira, you may have heard of them, lots of commercials. Even I've seen them in Canada. We don't have big pharma commercials, but when I see American stations, I see Humira. So she's going to go just completely in here, exposing his greed, and I'm going to get into more details after this clip in terms of just how badly he is screwing customers. First, check this out.
Mr. Gonzalez, how much did AbbVie spend on litigation and settlements from 2013 to 2018?
I don't have that number offhand. We'll be happy to give it to you.
Okay, $1.6 billion, $2.45 billion on R&D, $1.6 billion in litigation and settlements. What about marketing and advertising? How much does AbbVie spend on that?
Well, marketing and advertising, we spend about $4 billion a year.
Yep, 4.7, $1 billion. How about executive compensation, 2013 to 2018?
2013 to 2018, it's probably on average about $60 million a year.
Try 334 on for size. Now, how much did AbbVie spend on stock buybacks and stock buybacks and dividends to enrich your shareholders from 2013 to 2018?
Well, stock buybacks, if you actually look at just pure stock buybacks, it would be about $13 billion.
Stock buybacks and dividends is the question, sir.
Dividends, and have to come back with a number for that over that period of time.
$50 billion. So, Mr. Gonzalez, you're spending all this money to make sure you make money rather than spending money to invest in, develop drugs, and help patients with affordable life-saving drugs. You lie to patients when you charge them twice as much for an unimproved drug, and then you lie to policymakers when you tell us that R&D justifies those price increases. The big pharma fairy tale is one of groundbreaking R&D that justifies astronomical prices. But the pharma reality is that you spend most of your company's money making money for yourself and your shareholders. And the fact that you're not honest about this with patients and with policymakers, that you're feeding us lies, that we must pay astronomical prices to get innovative treatments is false. The American people, the patients, deserve so much better.
Incredible job. Incredible job once again by Katie Porter. Once again exposing the greed of a CEO. That took just 2 minutes. 2 minutes to show you how they use their money. It doesn't go to research and development to develop, new incredible drugs. This is the excuse they always make. Oh, we gotta charge these astronomical, insane prices, only in the US, mind you, because we have to be able to invest into R&D. Well, you saw how little R&D was compared to stock buybacks and how much these executives are actually making. Now, actually, a little more on that before I get to what AbbVie does to be able to jack up the price of Humira and just how much Humira costs. Before I get there, let's take a look at, again, where the money goes. Richard Gonzalez, his net worth is at least $173 million. So that's where the money goes, not into investing into new prescription medication to save lives. No, the money goes into executives. Now, here is the story of Humira and how insane the price has gotten and why they've been able to do this. So first up here, when Humira launched in 2003, under its former maker, Abbott Laboratories, the drug carried a list price of $522 per 40 milligram syringe. Abbott then raised the medication's price 13 times to $1,024 per syringe up until 2013, when AbbVie spun out into a separate company. After that, AbbVie raised Humira's price an additional 14 times. So how much does Humira cost now? A year's supply is $77,000. $77,000 for a year's supply of Humira. Now, they're able to do this because there is no price controls in the US. Unlike other countries that can negotiate down drug prices, for example, the cost of insulin is 10 times more in the US compared to Canada. Here you have Humira, $77,000 for a year's supply. So this is why Democrats right now are pushing for a law to allow Medicare to negotiate down drug prices, because as long as Big Pharma can charge whatever they want, they're going to charge whatever they want. And on top of that, the price of its cancer drug, Imbruvica, was raised to $181,000 per year. Unbelievable. Now, more on how they can do this. So they use what is called a patent thicket. This is where, as I'll get into here, they have a ton of patents on the one medication, which essentially makes it impossible for any generic versions of that drug to be produced and sold. So years back, AbbVie predicted up to 5 biosimilar competitors would enter the market by the first quarter of 2017 after Humira's active ingredient patent expired in 2016, the committee said, citing internal presentations. Another document sent to Gonzalez in 2014 warned that the biosim competition would cause price erosion and volume erosion for Humira's sales. In response, AbbVie built a war chest of patents to protect Humira's dominance, the committee found. The company now owns 257 Humira-related patents, the last of which is set to expire in 2037. Nearly half of those patents are from 2014 onward, indicating that most of these patents were not necessarily to incentivize the company's development of the drug. So you see what they did here? They recognized that if they weren't going to do something about this patent expiring in 2016, then there would be these generic versions of the same drug, Humira, and that it would cause them to have to lower their price. So what they did is what is called a patent thicket, where they brought in all these new patents, 257 of them, on the same drug, on Humira, so that it would make it impossible for generic versions of that drug to be produced and sold. And they did the same thing with another. So the company followed the same strategy for Imbruvica by obtaining or filing for over 150 additional patents to delay generic competition until 2036, the probe found. AbbVie's strategy, quote, is particularly abusive because it seeks to overwhelm potential competitors with the sheer number of patents on Humira, regardless of whether individual patents were properly granted under U.S. law, the committee argued. This is the greed of Big Pharma in a nutshell, and this is what they're able to get away with, specifically in the U.S., because of the lack of regulation. So you have here a situation where it is clear, this greed is obvious, it has been going on for years. You have Democrats in power now, in the White House, in Congress. They have to be able to do something here. Now, I understand in the Senate, they have only 50 votes, but I mean, through budget reconciliation, getting rid of the filibuster, through whatever means necessary, clearly something has to be done, at the very least, about the cost of prescription medication because of how completely insane and uneven it is in the U.S. compared to other countries.